CGRP is very interesting because, as I mentioned, it has changed the landscape in migraine. And we had hoped that it has the same effect in cluster headache, because there has been old studies that CGRP is increased during the attack, individual attack. We don't know enough about what happened outside the attack, but and because it has been small studies so far, but we are in the fortunate position here in the Danish Headache Center that we can use human provocation studies, because if we can provoke an attack with a substance, then we can identify a target, and then we can work on this targeted therapy. And that's one of the issues in migraine, that we could trigger an attack with CGRP, and we could abort it again with an antibody or a DPAN. So it has really moved the field forward tremendously with migraine. We can also trigger a cluster headache attack with CGRP injections in volunteer patients, but only if they are in the right position, you can say, and they are susceptible, because outside about you can't trigger that at all. But in the episodic ones, if they are in about 9 out of 10 patients, we can trigger a new attack. Of course, we can treat it in clinic as well, and in half of the patients with the chronic ones, we can also trigger an attack. But it is not so clear as it is in migraine, and it is certainly not so clear with the other neuropeptides, PACAP and VIP. It's only half of the patients that we can trigger an attack. So it is a different pattern. It is a different disease. It's a different reaction in cluster headache that it is in migraine. It's not part of the same spectrum. It's two different things, but there can be some overlap in the acute treatment, but not in the chronic. It's different. Talking about neuromodulation, that also has been used a lot in cluster headache, and is that it is also effective in some of these with episodic cluster, but not in chronic. It's completely negative. Study, same design, same type of patients, and same types of attacks, but not effective in the chronic one. So it is a different disease, the chronic ones. And those that have the chronic version, that means that they have no longer lasting period without attacks, 3 months in a year. They are really heavily burdened with their disease. So they are, and 4 times more costly for societal cost and personal cost, indirect and indirect, than the episodic ones. So there's a huge unmet need here.